Hey, it's Precious. Quick question though. Do you have someone in your life that has curves? Not that curves, but this curves. That's me, by the way, and don't worry, I gave you my consent to look at my back. So, this is what we call a scoliosis. It's an abnormal lateral curvature in the spine. Now, depending on a person's condition, their curve may look like a C or an S shape, just like this. It's like dancing on Shakira's Hips Don't Lie and your back suddenly decided to not go back to its neutral form. But in my case, the cause of my curves is called an idiopathic scoliosis, which means it's unknown. And it's frustrating to not know what's the cause of your curves, but as per studies, it may be linked to genetics. So thank you, Mom, I guess. The second cause is called congenital scoliosis. These can be detected as early as childbirth, and this is due to embryological malformation, while abnormalities in the muscle and nerves that supports your spine can cause neuromuscular scoliosis. Now, no matter what cause a person may have due to their scoliosis, they will always have a symptom such as back pain, uneven shoulder or hips, uneven leg length, and worst case scenario, they may have a hard time breathing due to their rib cage being uneven in height. While I know that it's impossible to magically straighten out our spine or go back to its neutral form by just stretching and doing less impactful exercise, but we can definitely stretch and strengthen our back muscles to prevent back pain and to prevent a severe curve on our spine with Klapp exercise. Now, my favorite Klapp exercise is called a lateral crawl. I'll demonstrate it to you guys. You would want to kneel on the floor. Now, your lateral crawl will depend on which side is your curve. Now, in my case, my curve is on the right side. Now, I would want to crawl laterally on my right. So, after kneeling down, you would want to do a tabletop. Make sure that your hips won't be going laterally to get along with your spine. So you would want your hips to be stable as it is, and you would want your spine to crawl laterally on the right and hold it for 8 seconds. Let's count until 8. 1, 2, 3, 4, 5, 6, 7, 8. Then go back to your tabletop position. That's actually recommended to do 10 times repetition and 8 seconds hold for each. And Klapp method is actually proven with lots of studies that it prevented or helped it to have a severe curves in our spine and also our back pain to be less painful. Now, depending on a person's curve, they must persist a doctor's opinion before doing any stretches or exercises just to be safe. So, thank you guys for watching regarding our scoliosis for today.